I'm Trish. Today I'm going to make a little video about my day of surgery. I know a lot of people, particularly people who have never had any surgery before, are full of questions, and it's a day that they really worry about, and that's understandable because you're having surgery. I'm an old hand at surgery, so I'm very familiar with all the procedures, what happens when you check into the hospital and all the processes that you go through. Having said that, I'm always okay till I get into the little room where they give you the pre-op and put the drip in, and every single person in the hospital comes to see you. I lose my shit then and start begging for Valium. That's because of what was supposed to be a very simple surgery. I was having my gallbladder out. It was meant to be keyhole, and and I've mentioned this before, it turned into open surgery, and open abdominal surgery is very unpleasant. So when I get into that little room, it's a bit of a trigger for me. So I will start with, straight off the back of my last video, the 2 weeks of pre-op Optifast prior to going in for surgery. I did that, and I think I knocked off about 4.2 kilos or something like that. It wasn't a real lot compared to other people, but as already mentioned, I'd already lost 10 or 15 kilos before that. So on surgery day, I think I was about 140.4-ish, 140 point something. So anyway, the next morning, my sister came and got me, because she's a treasure as well, and drove me to the Alfred Hospital. It's about an hour's drive from my place. Yeah, I got into the Alfred Centre with my sister at about 12 noon, and we'd barely even had time to sit down before the nurse called us in to start all the process. When you go to hospital to have surgery, you have to see everyone in the hospital. So we booked in, we saw the anaesthetist, the pharmacist, the nurse. I was weighed. They then took me through to a cubicle, and they gave me a hospital gown, a gown that actually fit me. Now you people who haven't been banded yet or are still fairly early on in your adventure, you'll know how mortifying it is to go anywhere for an ultrasound or an x-ray or any kind of doctor's appointment where you have to put on a gown, and they always give you this little gown that's like about a size 4 to fit a 4-year-old, and you have to stand there in all your your obese glory and say, this won't fit me, can I please have a bigger gown? And then they're all, do I have to get you a gown that's bigger? I don't know where they are, I don't know where to find them. Please, if you are a medical professional watching this, please have some compassion for really obese people. It is difficult enough without having your dignity just ripped to shreds by not even having an appropriately sized hospital gown available for you and having to ask for one. Please try to remember that. So anyway, they gave me a hospital gown that actually fit me. Probably could have fit 2 of me in this hospital gown. It was that big. It was wonderful. And they gave me a dressing gown, a good sized dressing gown to put over the top of it, and one of those really cool little caps that make you look really pretty, and booties. I don't know why they give those booties, because they're really slippery. They should put those little sticky things on the bottom of them. Anyway, so I went in and I got changed. And to answer one of the most common questions I've seen around the place, are you allowed to leave your undies on? I think it depends on the surgeon. I've always taken my undies off for every surgery, I think. And I think it's a good idea, because if shit goes down and you're in surgery and they need to, jumpstart you or anything like that, you don't want them to be having to stop and take your undies off. And also I think I saw someone say, depending on what undies on you, if you're wearing your sensible cotton undies, probably no big deal, but if you're wearing lace or nylon or something and they've got to jumpstart you, I think you can get burns from it or something. Maybe that was jewellery. I don't know. Just take your undies off. They're medical professionals. They're not going to get you into surgery, put you under, call all their mates in, lift your gown to see if you're shaved or not. They're not going to do any of that, okay? So I got changed, and then I came back out, and they got me to sit in another little waiting room with very comfortable chairs. I think, I can't remember, I might be remembering a different surgery. But I was in a room full of lots of other really fat people, must have been lap band day, in a room full of lots of other really fat people who were all wearing very attractive gowns and dressing gowns and hats and booties, so I felt like I was in a club already. And they let my sister wait in there with me, and I only waited probably only about 10 minutes, really only long enough for me to log on to a lap banding site that I'm on and post a message saying that I was excited or whatever, waiting for my surgery. And then a little before 1 p.m, so it was all pretty quick, a little before 1 p.m. they came and got me, and I was very excited, and they took me into that little room like just before theatre, and then I lost my shit. Then I was like, can I please have some Valium? Please give me something. I'm really anxious. And because, you know, there was 2 anaesthetists there, and the surgeon came in, and the nurse was there, and they wanted to sign forms, and they're trying to put a drip in. And I'm mostly pretty fine with needles now. I'm actually a phlebotomist. I'm a person who can take your blood. I'm qualified to do that. I don't work, but I can do that. So those needles don't bother me, but a needle in the back of my hand, no sir, no. But I picked that surgery to be brave, and I thought I'm going to let them have a go. I'm going to let them have a go at getting a drip in my hand. So they had 2 goes, and it wasn't working, and it was really hurting, and I just became the world's biggest pussy, and I said to them, can everyone just back off for a minute, because I'm feeling very out of control. Because they always want you to lie down as well, and I don't like to lie down. I like to sit up and watch what's going on. So they all backed off for a minute. They were all so lovely. Then I did a deal with the anaesthetist and said to them, can you please put the drip in my elbow? And I said, just get it in there, put me out, and then pop one in my hand. And they said, yep, we can do that. So when I woke up, I had one in my hand and one in my arm, plus they stuck there's a couple of little dots just there. Because I was so big, and it was so difficult to, I'm just going to turn that off because that's going to be the shits. There'll be no more dinging now. Because I was so big, it was very difficult to get a blood pressure cuff on my arm and get an accurate reading, so they do this special one where they put a cannula directly into an artery, and they measure your blood pressure like that. I felt quite relieved that they were going to do that, because I knew then that it would be accurate, and they can do whatever they like to me once I'm out, I don't care. So they got all of that done, and then they wheeled me into the actual theatre, and then they wanted to put and then everyone was buzzing around, and that just makes me feel very chaotic. I don't do well when I feel chaotic. So I was, my anxiety was getting higher and higher. And then there was a lovely nurse in there. He was just so beautiful, and I said to him that I was feeling very anxious, and so he gave me this tube of cream. I don't even remember what it was, but it was just this plastic tube of cream, and he gave it to me, and I'm like, what do you want me to do with this? What's this for? And he said, just squeeze it. And so I'm squeezing, and I'm going, yeah, okay. And he said, now you've got something that you're in control of. And I thought, oh, okay, that's really good. I can just concentrate on squeezing this cream. And I know it sounds stupid, but it really helped. And then before they put you under, especially when they're going to put a tube down your throat to help you breathe, they put a mask on your face to give you a really good hit of oxygen, because in case it takes them a little while to get that tube down, you need to be really well oxygenated. Now, in another previous surgery I've had, and I have had a lot of surgeries, I think I counted up before, it's been about 8 or 9 surgeries where they've actually cut into my body, and then I've had probably another 4 or 5 gastroscopies and a couple of colonoscopies, and then I've had some other stuff when I was away, like moles removed and stuff. So I am an old hand at surgery. So in another surgery I've had, when they put the mask on my face, it wasn't turned on, and I know it was a bit weird because it must have had an airlock or something on it. They've normally got little holes, I think. I don't know. But so they put this mask on my face and sealed up my nose and my mouth, and I've gone to breathe and I couldn't. So I was just sucking in nothing because it wasn't turned on. So I said to this beautiful nurse that had happened, and I was very anxious about the oxygen mask. So he got the mask and he turned it on and he just put it on my neck so I could feel the oxygen blowing onto my neck, so that I knew to reassure me. And then, you know, he put it on my face. I cannot speak highly enough of every single person who was in that theatre when I was in there, because I was a real basket case. I must have been a real pain in the ass, but they were all so patient and so beautiful to me. So I had the surgery, and then I woke up in theatre, very, very, very relieved, because I was just in normal pain, normal post-surgical pain, which was still a lot of pain, but not the blistering, I want to die pain that I had when I had my gallbladder done. I just had, I had pretty bad shoulder tip pain. That's because of the gas that they pump into you when they do keyhole. And I had like a band of pain, I don't know if you can see, band of pain just like right around my chest, around the bottom. And I told the nurse that I had chest pain, and she said, whereabouts in your chest? And I said, just, you know, around the bottom. And she said, but not in the top? And I said, no. And she said, well, that's good, that's not your heart. Oh yeah, I should say, like, they took me around to surgery at 1, so by the time they actually got me into theatre and got me under, it would have been probably about 1:30. And then I was in recovery at 3:30. So I think the surgery took an hour and a half to 2 hours, I suppose. And then I was awake at about 4. Yeah, so I woke up in pain, quite bad pain, so they gave me Oxycontin. Oxycontin? It's endone through a drip, same thing. And they topped that up about 6 times before I had enough pain relief. They can only give me so much painkillers because I'm really sensitive to all side effects. I can't have morphine, I hallucinate on ketamine, fentanyl depresses my breathing, I will never have tramadol again as long as I live. I am a real princess when it comes to surgery. So yeah, so the endone, or the Oxycontin, made me quite nauseous, so they also gave me a concoction of about 4 different antiemetics. So then I wasn't sick at all. When you go in and have your surgery, if you come out of the surgery, or even like any time post-op in the hospital, on the ward, whatever, if you're in pain, tell someone. Use your call button and tell the nurse, and they will get you pain relief. If you feel sick, tell someone. Again, tell someone. They will give you drugs like really quickly, straight through your drip, and the nausea will go away. Or if the first lot of anti-nausea medications don't work, they'll give you another one, they'll give you another one, they'll give you another. You don't have to be feeling sick, you don't have to be in extreme pain, they can help you. Now, when I first got into recovery and I woke up, my blood pressure was quite low. Apparently that's, you know, a normal thing to happen, or a normal thing that can happen after surgery. They took me back to the ward at about 5, and my blood pressure was then quite high for a little while, but that was just because of the pain and, you know, all that sort of thing, the stress and whatever. And I was a little bit stressed when they first took me back to the ward because of the bad experience I had when I had my gallbladder taken out and all the cocktail of drugs they gave me after that. And they gave me a truckload of drugs. That's what they called it. When my sister said to them, what painkillers has she had? They said, we have given her a truckload of drugs. When they gave me all those drugs, every single time I fell asleep, I stopped breathing. So when I got back onto the ward after, and I should mention that I almost ended up in ICU after my gallbladder, it was that bad. So anyway, when I came back to the ward after having my lap band done, I was afraid to sleep because I knew that I had some opioid painkillers on board, and I was worried that I would stop breathing. So the nurse came and she got right up close to me and she said, I'm not worried about you, so you don't need to be worried about you. And that just worked like, it was like she hypnotised me. I went, oh, okay, that's all right. And I just went to sleep, and I was fine. I was fine. And then by about midnight, my blood pressure came back down to normal. They also gave me an anticoagulant injection, probably would have been into my tummy or my thigh, before I woke up from the surgery. But if you do have to have those, don't worry about them. they're in the teeny tiniest little needle, and they don't hurt. They're like a tiny little needle like this. They go into your belly or into your thigh. In the thigh they sting a little bit, in the belly they don't hurt. Sometimes they do the injection and then they take it out and then you get like a little sting. But it's honestly, it is so much nothing. I'd be able to do one of those needles myself. And a lot of the time now, I didn't get them, but you can get these really super sexy like socks for in the hospital. Actually, I've got some. Yeah, you might think it's odd that I have a pair of these laying around, but my son had surgery last week, so he got some, and I grabbed them off him because he's not going to need them anymore, and I'm having a tummy tuck and breast reduction sometime this century, so I kept them, so I've got a spare pair in case I need them. Look at that. Wow, how sexy is that? And they've got this, I really hope you can't see out my undies when I'm doing this. They've got this little hole in the top, but it's so they can check the colour of your toenails to see if, make sure that you're not having your circulation cut off, because they're meant to be quite firm. That just keeps the blood flow going up, keeps it nice and firm, so that you don't get blood clots, and that's what the anticoagulant injections are about as well. These are so tight. I'm exhausted now. I had 3 wounds, one bigger one and 2 smaller ones. I'll pop up a picture of those. The bigger one, well, you've seen them. It was about that big. And the other one, the genius one, was right in the middle, right under where my bra goes. And I thought, that's genius. That is absolutely genius. And my surgeon was a woman. I thought I was going to have a lot of trouble with that, but I didn't. I wore a bra the next day. It was fine. No pain or anything. The only problem I had with that one, and it was only a tiny little one, like a really little cut. I didn't have any external stitches. I think they glued me and they just put steri-strips on, and then internal dissolving stitches, and that works for me. I don't like having stitches taken out. That little one, the tiny little one underneath my bra strap, a stitch poked out, and it's like a little piece of fishing wire, and it wasn't long enough for me to snip off, so you didn't hear this from me, but I just got a razor and I just shaved over it, took care of it, it was fine. Yeah, so I didn't really have much wound pain, a little bit from the bigger one, but like nothing bad. I had a lot of left shoulder tip pain. That's because they fill your tummy with gas to make room in there for all their instruments and stuff, and it pushes everything up so that, you know, like this, and it does cause a bit of pain, and I had pain from that for probably about 4 days, I think. I was getting a little bit over it by about day 4, but then it disappeared. Best thing you can do for that is walk around, burp and fart and just like move around. That is the best thing for it. I was up and about an hour or 2 after I got back to the ward, and weeing like a beast, like every couple of hours. So I was up and down all night. So I think that helped a lot. I got up at about, I don't know, about midnight, I think, and went to the toilet, and as I bent over, I let out the biggest, bestest burp of my entire life, like bar none. And then I let out a couple of smaller burps, and within minutes my pain had like halved. It made such a huge difference. I also had a lot of chest pain, like a ring of pain around the bottom of my chest, and it felt like someone had poured broken glass down my spine. Having said that, I quite often get that spinal pain anyway. I think it was just made worse with the surgery and probably the way they had me positioned and all that sort of thing. You know, they just gave me painkillers. I think I had endone the next day and topped up with Panadol. And then from day 3, I think I was just on Panadol during the day, and I took endone at night for a couple of nights. And then I think I probably just stopped taking painkillers altogether. Because endone is an opiate, you've got to be really careful with it. You can get addicted to it. It has got sedative properties, so it was helping me to sleep at night. So when I stopped taking it at night, I had trouble sleeping for a couple of nights. I can't remember, I may or may not have taken a sleeping tablet for those couple of nights just to get me over the hump of it. I don't know. I do take sleeping tablets probably about every 3 or 4 weeks now, just to re-regulate my sleeping pattern because of my anxiety, depression, fibromyalgia, blah blah blah. That's a whole nother story. I just don't want it to sound like I take sleeping tablets every night. I don't. Now, with a lot of people, now this is relative. Getting lap banded is painful. You are going to have pain, but the pain that I had was relatively almost nothing for me. But I've had a lot of surgeries. I've had open abdominal surgery. I've had 2 cesareans. So the pain of a keyhole surgery was really very minor for me in comparison to those other surgeries. If you've never had surgery before, you're going to be in pain. You know, you're probably going to think it's the worst pain of your life even, because it might be, if you've got nothing worse to compare it to. But you will get over it. A lot of people talk about sleeping in recliners for weeks afterwards. I was fine. I slept on my sides and my back in the hospital on the first night. And I found that my normal sleeping pattern, not until recently, I can't sleep on my tummy anymore, but I sleep like a rotisserie. I'm just rotating. So in the hospital I slept on my back a bit, and then I slept on my right side, and then back to my back, and then onto my left side. And I did have pain, but I found that the pain like wriggled its way up to the highest point in my body. So if I was laying on my right side, it made its way up to my left shoulder. If I was laying on my left side, it wriggled its way up to my right shoulder. But then if I just laid still for 5 minutes or so, the pain, it dissipated, and I was able to sleep very, very comfortably. From the second day when I was home, I had a nap in the afternoon. I slept on my tummy because I was a tummy sleeper then. No problems. They bought me lots of fluids and jelly after the surgery. Well, when I say lots, they bought me a juice and a cup of tea and a bowl of soup and a jelly. I had a bit of black tea. I had some chicken noodle soup, sans noodles. My sister called it chicken water. Pretty apt. And then you know the little tiny juices, and I'll post a pic of this as well. The little juices and the little jellies that you get in hospital. It took me 6 hours in the hospital, but I got those down as well because I knew I had to keep my fluids in. They had me on a drip, but you know I knew I had to get my fluids in. And while I was in the hospital, every single teeny tiny minute little sip that I took, after a few seconds after swallowing, I had some stomach pain that only lasted a few seconds, and I told the nurse about it, and she said that was fine. It was completely normal. Nothing was bad. Nothing bad had happened. So I got through that, and it wasn't excruciating or anything. It was just like, oh, that hurts a little bit. And I'll tell you, that apple juice and that jelly, after 2 weeks on Optifast, heaven. So much sugar. It was a bit silly, really, but anyway. Now, there was another question that I see people asking a lot. Oh, ladies, I have seen so many women stress over this, and it is just don't stress about this, because it is nothing to stress about. So many women ask, what if I have my period when I go in for surgery? And I say, if you don't have your period going in for surgery, you'll have it when you come out. The general anaesthetic does something to your hormones, and it does bring on a bit of vaginal bleeding, much like a little mini period. I was bleeding through the night after my surgery. So just take some pads or tampons or whatever, or you know, if it happens and you're caught off guard, just tell the nurse. This is their job. They have seen everything. Trust me, they have really, honestly seen everything. There's no need to be embarrassed when you're going into the surgery. I think a lot of surgeons don't like you to use tampons. Some are fine with it, some don't. And even if you're not wearing undies, it's fine. The nurse will just give you a pad. They'll just jam it in there. You'll be fine. There is honestly nothing to be embarrassed about. And don't be concerned if you do have a bit of bleeding afterwards, even if your period wasn't due. That's pretty normal as well. I think that's all.